This week's Medicine of the Week is a class of drugs called the 5-hydroxytryptamine 3 receptor antagonists, also known as setrons or selective serotonin 3 receptor antagonists. These drugs are widely used as antiemetics. Most known and used examples are ondansetron, granisetron, and palonosetron. 5-hydroxytryptamine 3 receptor antagonists block the action of serotonin by inhibition of its binding on the 5-hydroxytryptamine 3 receptors. These receptors are located both peripherally on gastrointestinal vagal nerve terminals and centrally in the chemoreceptor trigger zone in area postrema. Blockade of these places results in powerful antiemetic effect. These drugs are commonly used to prevent chemotherapy-induced nausea and vomiting, postoperative nausea and vomiting, and also nausea and vomiting associated with radiation therapy. Unlike the others, palonosetron triggers 5-hydroxytryptamine 3 receptor internalization and induces prolonged inhibition of receptor function. Therefore, it has also a specific indication for prevention of delayed chemotherapy-induced nausea and vomiting associated with highly and moderately emetogenic chemotherapy. 5-hydroxytryptamine 3 receptor antagonists are used as antiemetics in monotherapy and in combinations with other drug classes, for example NK1 receptor antagonists or dexamethasone, especially in highly emetogenic chemotherapy. Setrons are well absorbed after oral administration. They undergo extensive hepatic metabolism, primarily via cytochrome P450, and are excreted through urine and feces. Dose adjustments in case of renal impairment are not necessary. The half-life of 5-hydroxytryptamine 3 receptor antagonists varies widely. Ondansetron has the shortest half-life of approximately 3 hours, granisetron around 9 hours, while palonosetron has a much longer half-life around 40 hours. Therefore, it is often used as a single dose. These drugs are available in various formulations for oral and parenteral administration. Very useful are orally dispersible tablets or transdermal patches, offering flexibility in administration in nausea or vomiting. The frequency of dosing depends on half-lives of particular drugs. The standard dose of oral ondansetron is 8 mg, and the drug might be administered every 8 to 12 hours. When given intravenously, the dose is 0.15 mg per kilogram, infused over 15 minutes with a maximum of 16 mg per dose. The frequency is 8 to 12 hours, as in oral forms. Standard dose of oral granisetron is 2 mg once daily and 10 micrograms per kilogram when given by intravenous infusion. Granisetron is also available in transdermal patches with strengths of 3.1 mg per 24 hours, and this patch can be left on the skin for up to 7 days. Standard dose of oral palonosetron is 0.5 mg as a single dose and 0.25 mg intravenously infused over 30 seconds as a single dose. Dosage of these drugs may differ in case of highly emetogenic chemotherapy, so further information can be found in ESMO guidelines. Common side effects of 5-hydroxytryptamine 3 receptor antagonists may include headache, constipation or diarrhea, fatigue or dizziness. We should also mention possible QT interval prolongation that could be aggravated by electrolyte imbalances caused by prolonged or intensive vomiting. Caution is needed for patients with a history of congenital long QT syndrome, ventricular arrhythmias, cardiac disease, or with those who are receiving concomitant cardiotoxic chemotherapy. Although uncommon, some individuals may also experience allergic reactions, which can manifest as skin rash, itching, or swelling. An overdose of 5-hydroxytryptamine 3 receptor antagonist is rare, and there is no fatal dose established. Let's look at interactions. Interaction of setrons with apomorphine is well documented. Serious hypotension and loss of consciousness was reported when co-administered with ondansetron. Therefore, this drug combination is contraindicated. Concurrent use with other serotonergic drugs such as SSRIs or SNRIs, triptans, or tricyclic antidepressants can increase the risk of serotonin syndrome, characterized by symptoms like agitation, confusion, or increased heart rate and blood pressure. Another interaction occurs in case of co-administration with medications that prolong the QT interval, such as clarithromycin, amiodarone, or voriconazole. As a result, serious cardiac arrhythmias may occur. Despite of the fact that 5-hydroxytryptamine 3 receptor antagonists are metabolized by hepatic cytochrome P450 enzymes, co-administration of inhibitors does not lead to clinically significant changes in plasma concentrations. There are several cytochrome enzymes involved in metabolism, so the inhibition of one enzyme type is compensated. Inducers of cytochrome P450 may, on the other hand, decrease plasma concentrations. To summarize, 5-hydroxytryptamine 3 receptor antagonists are potent antiemetic drugs used to prevent CINV, PONV, and radiation-induced nausea and vomiting. Remember also the differences in pharmacokinetics that influences the dosing of particular drugs. Setrons are available in a wide range of dosage forms, which is convenient for both the doctor and the patient. And finally, watch out for drug interactions with serotonergic drugs, QT prolonging or cytochrome-inducing drugs. Thank you for your attention.